I'm happy to invite our first speaker, Dr. Jonathan Schler, which you've already met, and he's the head of the Department of Computer Science here at AI2. Jonathan's research focuses on machine learning based on text processing, especially in the area of authorship profiling, and he will talk about it in a minute. In parallel, he's been involved leading technology teams in various companies, including startups as well as public companies in the past 25 years. Jonathan holds a PhD in computer science from Bar-Ilan University, and I can say that he's also a star performer in a course on data science here in the Israeli MOOC platform campus. So I'm happy to invite you, Jonathan.
Thanks, Michal. AI2 is not only for the second time I'm standing here on the stage, but what I'm going to talk about is authorship profiling in social media from a mental health perspective. And this is a joint work with my colleagues, Professor Molly Ireland and Dr. Kate Niederhofer from the psychology department at Texas Tech University, and Gilad Gecht, which was a student here at HIT last year, 2 years before. So first, before we start, I want to share my area. My PhD was in the area of authorship, and I feel it fascinating, and I want to share it with you and explain why I'm fascinated about this area and why I think it's interesting. So first, it's a sub-area. It's related to artificial intelligence. Otherwise, I couldn't have the opportunity to talk in this conference. But it's not only artificial intelligence. It's also based on machine learning, and particularly deep learning in recent years. And I think also Roberto mentioned that in one of the in his talk. But it combines not only the computer science elements, machine learning, but also linguistics. Linguistics is the study of language, and it's in the interaction between them, because we build computational authorship analysis, build computation models to analyze promise of authorship of who wrote the text, and to do that we need to analyze the language that that person uses when he writes the text. And this interacts not only with the language that it uses, but also the psychology behind that, or some of the psychological elements that are involved. And this will be the focus of this talk about area that is in the intersection in between essentially where you see the neural net basically in the middle. So once we understood why authorship is interesting, and I hope I was able to convince you, let's talk what is authorship profiling. So authorship profiling is a sub-problem of what's called authorship analysis, and authorship analysis has 3 sub-problems. The first one is authorship attribution. What do I mean by authorship attribution? Authorship attribution is when you're given a text, an anonymous text, that you don't know who wrote that text. For example, you got an email from someone that you know is a fake email address. Sometimes I get emails from students that don't want to send who they are, so they open another email box and send me the email, and I need to think who was the student that sent me that email. And so I have a set of candidate authors, candidate students or whatever, and I try to apply methods of machine learning to decide who that author was. So this is a reminder to the students that send me anonymous emails. But what we do is, based on these examples, we decide who that author is. This is a fairly simple problem in authorship analysis, and the problem gets more complex. The second one is authorship verification. What is authorship verification? In authorship verification, we have a piece of text that it has 2 sides. One option is that this piece of text is signed by someone. Says, okay, it says here that this was written by Jonathan Schler, but I claim that I never wrote this piece of text. So now we need a system that can prove whether I wrote it or didn't write it. Or the other way around is that we don't know who wrote it, or we assume that that person wrote it, but we want to prove that this is something that that person wrote. This is a more complex problem. It's called authorship verification. The third problem that we talk about is authorship profiling. In authorship profiling, we don't have information about possible candidate authors. We don't know who is a suspect author at all, or it's kind of an endless open question. And what we try to do is build a profile of that author. It's like a police investigation where you need to find suspects, you don't know who they are, and you try to build a profile. And that profile can be built from several elements. For example, basic elements like gender and age. Is that a male or female, what age range, and so on. We can talk about emotions, personality traits. In psychology, we have these big 5 personality traits of kind of trying to build that profile. We can talk about political orientation, native language. which is also a useful thing to know, is that the native English speaker, non-native English speaker, where you come from, and so on. And today what we want to talk about is mental health. Can we understand, build a profile from a mental health perspective about the author of that given text? So the current research question that I'm going to present is, can we build a system that analyzes text in a neutral setting to decide, to find out if that person suffers from depression? Depression as one example of a mental health condition. And why is this important? Because so far, research that was done in the field was either done within a clinical environment where someone goes into psychotherapy sessions, for example, talks with a psychotherapist, and he analyzes what he talks about, but this is a very specific setting, specific environment that they talk about mental health. There is other work that was done about, for example, detecting mental health discussions on the internet, which is dedicated to mental health. Here we talk about a neutral environment. A neutral environment, I mean something that is not related to mental health at all. So you talk in occasional conversation or a forum on the internet that has nothing to do with mental health. Can we analyze the text and build a profile of the user and understand what it's about? And this can be applicable to many problems, from health related to security and others, that is very important. A sub-problem of that is, due to the emergence of recurrent deep learning technologies or classifiers, many of them are black boxes that are hard to interpret, or there's work going on to make them, move them to interpretable systems, but so far they are not that good. So can these models, even if they work better than the other ones, work in line with these theory-based predictions that we had previously? I'm not sure I'll be able to talk about that because I want to make it a bit shorter this time to catch up on some time that we lost. So to give you an illustration, here you have two users. You can read their posts. I use Action Launcher Pixel Edition. I have some questions for support. Another one is, I got an email from Cameron. Can you guess who is depressed and who is not depressed? You can see this is environment neutral, nothing to do about depression. Any guesses? Who thinks user A is depressed? Okay. Who thinks user B is depressed? Who doesn't think? Or who thinks there is no? Okay, so I will not tell you the answer. You have to wait, bear with me till the very end of this talk, but I promise you I'll give you an answer about it. So how are we going to tackle that problem? How will we solve the problem? So like any machine learning problem, if we want to build a supervised machine learning algorithm, we need to have what's called a data set to train the system. So to build a data set, what we need to do is to create a data set that is topic neutral, a set of authors, and each author in that topic neutral environment, we have a label. Is that a depressed person or not depressed person? Is that easy? No, not at all, because we don't have any such information. So the first challenge that we need to do, which is not trivial, is create such a data set. The second challenge is to build, then based on that data set, once we have it, a classifier that does this task. But this is also a non-trivial task because it's unlike traditional text or topic classifier that classify text according to what's said in there, what's mentioned in there. Here we need to do something that's called style-based classification or other methods that are related to the mental health of that author. So let's see how we did that. For the first step to create the data set, what we did is we started to crawl the internet for Reddit. For those that are not familiar with Reddit, Reddit is a social media platform, a question answering platform. People ask questions and get answers from various people and on many different topics. So we crawled it, and we crawled over 2 million posts. And we did it for over 50,000 subreddits. Subreddits are different topics that are on Reddit, on every imaginable topic possible. We collected close to 50,000 users over a span of 11 years, with yielding a result of average of about 37 posts per user on average. The problem is, it's great to have that data set, but we have no information about who the users are. We don't know which of them is depressed or not. So what could we do about it? A naive approach would be, let's use text classification, read the text and say, okay, is the text about depression or not depression? Yes, we can read those texts, build a classifier. In fact, we did such a classifier. We took the discussions in the depression subreddit, which is obviously about depression, And we took another subreddit called Ask Reddit, which are general questions to the Reddit users, Reddit community. Here you have the number of posts in each of them. And we built a classifier. It was a logistic regression classifier, and you could see pretty good results, close to 90% precision recall, so it means it does a good job. However, person talking about depression doesn't mean that he's depressed. Even if that person is active in a depression forum, you can say, let's take all the users that post in those forums. It's not necessarily a depressed user. You know this opening for a post is posting for a friend. Yeah, so many posting for friends over here. So what would we do? What can we do with that? So we try to improve our approach and use what's called self-disclosure. So we used the classifier that built to detect depression forums, and we extended the search to additional subreddits that have a very high rate or high percentage of discussion about depression. And I can give you an example of forums that can be related to that, like anxiety, even forums about breakup relationships and stuff like that. There are forums that are heavily geared towards depression-related discussions and also somewhat depression-related users. But this is, as I said, is not enough. What we looked is for self-disclosure. So people had said, I was diagnosed with depression, or I'm taking these and these meds, that those meds are used for treatment of depression and of the kind. And we use that as saying, okay, that person, based on his self-disclosure, is diagnosed with depression. We would label that person as a depressed user. Based on that, we came up with a set of 3,400 users that were verified as suffering from depression, and a subset of close to 3,300 of them. We looked on all the wide range of forums that we collected and saw that most of them posted also in neutral subreddits. So while they were asking depression-specific questions in the depression forums, they were talking about other topics in all these other forums, and as a result of that, they might be good candidates to be used for our research. So now we are getting very close to build our data set. What we did is we gathered a sample of 22,000 users that posted only in depression-related forums. So we know that we assume they are not depressed. Obviously, it's based on self-disclosure, so it's not 100% accurate, but it's as large as we could get. And we verified that they had more than 10 posts. So they had the opportunity to express a depression in some way or another, and they haven't done that. And this is north of 300,000 posts. And we combined that with a data set of the 3,297 users from the previous step that were self-disclosed themselves as depressed. So with that, we achieved the first step. And now we could move to the second step of build such a classifier. To build such a classifier, what we did is we balanced the data set, so there will not be any preference to one data set over the other. Obviously, we had much more non-depressed users, so we wanted to balance that in order to be able to detect the depressed users. And we used various sets of feature sets like bag of words, which means the words that we used in the text, the 10,000 most popular words. We used, I'll skip the LLC for a second and go back, character engrams, which means sequences of between 3 and 5 characters that are not words but subwords. That way we could capture prefixes, suffixes, and variations. And also LIWC. LIWC is linguistic inquiry word count, which is a data set that is heavily used in psychological profiling and work on psychological analysis. It creates groups of words and tries to associate words with different topics. So we use that as feature sets. We trained several classifiers, logistic regression, SVM, random forest, and also we used a BERT-based language model, which you could say BERT is also feature set. So and the classification layer on top of it. When we look the analysis we did analysis at the post level. We had a total of 130,000 posts, almost balanced between depressed and non-depressed users. We did a train test split of 80-20. So 80% was used for train, 20% for test, and 10% out of the train was used for validation. And we got the best feature. Obviously, BERT outperformed all these models, and you can see it got almost 80% precision and recall, which is very high in this type of setting of problems. We usually talk about even lower problems. out of the non-BERT, non-deep models, we can see that the bag of words and LIWC in the second row with the logistic regression also achieved fairly nice results, although not as good as the BERT. The advantage of that is that this model is interpretable as opposed to BERT that is not interpretable. When we look on the model itself, we can see that, for example, if you start from the top, the non-depressed user use affiliation. And affiliation LIWC means this is a feature from the LIWC feature set, which means that that person is affiliated or looks to the external world, is affiliated to other places, talks about friends, the word they, feelings, thanks. These are top features. Obviously, there are much more features. And when we go to the depressed user, we can see I and I am, which are first-person usage, does and don't, which are negations, and also in general negative LIWC. These are the strong features. If you go back now to the question that I've asked you at the beginning, who is the depressed user or not, let's see if you can now see and detect who is depressed and not. A, exactly. So A is the depressed user. Very nice, good guesses. And how we see that? First, if you look at the first person, you see that user has 5 times the I as opposed to 1 time here in the user B. Negation, even in a short text, huge much more negation than the non-depressed one. But then when you look on the affiliation, he talks about the membership, use, yours is kind of up, which also, I haven't spoken about anyone and someone, but anyone means like, I'm lost here. There is anyone here to help. Anyone is in the crowd, as opposed to someone which is more specific, and we see that this is also a difference in that. So this is an example of how we can use the language to do that. I just want to mention one. So this is briefly touching on the question I asked. This is more or less aligned also in some layers to the existing research on the field. And I think one of the interesting questions is implication of such models. And this is one of the future panels. What are implications of that for privacy perspective? So if I can analyze all the posts and I know what mental health conditions people suffer from, what does this have to do with privacy, personal privacy? Are there ethical concerns about that? Because if I tell you that you have a likelihood to be depressed, maybe this itself makes you depression. So all kind of questions that we can ask. And also an interesting question that is actively being researched is, here we see that language reflects mental state, but can we use the language to affect the mental state? So if I train people to write in a different way, can this have a positive impact on the personality? This is stuff in actual research, very interesting. So these are kind of questions that I will not talk about, but give you some food of thought, and people in the crowd that want to think about a thesis in the future or doctorate or whatever research, then this is that. So at this point, if you have any questions.
Did you examine also punctuation? Also in your example, you had a question mark.
Yes. So we consider question marks, examination mark, 3 examination marks, 3 dots, and that type of features. Yes, they are also there. They're not that strong. So I took only the top 5 here, but yes.
Have you tried to work with emojis?
Yes. We did. There's a different study with emojis as well. They express a lot of information. In Reddit specific, there is less usage, but if you go to Facebook and other platforms, yes, definitely.
How did you handle another mental health condition that might be related or close to the depression? Maybe someone just write an angry post at this specific moment, but he's not in a depression condition. To relate to someone else, like he's not in a depression or he.
So first we look, if he says, I suffer from depression. So even if I look only on the person, we took the person that disclosed themselves as suffering from depression. But you mentioned a good point, which is depression is not a steady state. There are ups and downs. And one day I can be in a very positive mood, and the other day I can be very down. So yes, there are these fluctuations, and the model has to reflect that, and can fine-tune it but I don't have the time now to talk about that. So I'll be glad to answer further questions after in one of the breaks. Thank you, everyone.